the MDS-005 is a study meant to find a way to have a erythroid response, meaning an increase in hemoglobin in patients with lower risk MDS who already received erythroid stimulating agents or who are not eligible for this kind of treatment and require transfusion. As you may imagine, transfusion need is a big problem for MDS patients because it's chronic. It's going to require a lot of effort from the family, from the caregivers, from the patient themselves, and their quality of life is of course affected by it. On the other hand, transfusions are very important to keep hemoglobin levels high. So we wanted to verify whether lenalidomide, which is a drug called Revlimid in commercial use and is used in a specific type of MDS characterized by a deletion of chromosome 5 with a great success. We wanted to see whether this drug could be used also in patients without this chromosomal abnormality and requiring transfusion. And this is what we did. So we controlled the study by giving to a group of patients placebo, meaning that 2 out of 3 patients got lenalidomide and 1 got a placebo. The result of this study is quite interesting because overall there were 27% of patients who achieved transfusion independence. They completely stopped transfusions and had a good level of hemoglobin. But when we went a little bit in detail and we analyzed in depth who were the patients who responded to lenalidomide, we could see that the patients were responding were the ones who received as a prior therapy ESAs, erythropoietic stimulating agents, and even more interesting, the patients who did not have high levels of endogenous erythropoietin. We do produce erythropoietin to stimulate red blood cell production, and when you are anemic for a long time, very often or quite often you may have increase in erythropoietin levels that you produce. When the patients did not have this super overproduction, they were really prone to respond to lenalidomide, so that we could select a group of patients who received ESA, who had transfusion dependency, but who achieved more than 42% response by being treated with lenalidomide, which is a very important step forward for our patients. You know, the patients who received ESAs and then lose response are bound to receive transfusion for many years, and their survival is not only a little bit shorter, but it's also affected by the decrease in quality of life, as I mentioned before. So I think this is a very important finding that we have here. We have another tool to restore good hemoglobin levels for MDS patients. Not all MDS patients, but some that we may select on the basis of very clear and easy clinical parameters. Quality of life is a very important issue to look at, because now EMA, the European Medical Agency, has put a lot of stress on this point. Why is that? Because patients do have an impairment in their quality of life, and improving it beyond the result of improving erythropoiesis or improving hematopoiesis is very important. So if a patient increases hemoglobin but doesn't feel well, this is not a real step forward. But if the patient increases hemoglobin and is feeling better on several points of view, then we are really achieving something, a good result. So in this study, the patient who achieved transfusion independence for more than 8 weeks had also a significant improvement in physical activity, a decrease in negative parameters like dyspnea and fatigue, and therefore we really hit the target of improving their life beside increasing their hemoglobin level. When I see a patient who has lost response to ESA, I propose a new drug, which is lenalidomide. It's not a new drug, but a new drug for this kind of patient, provided this patient has the characteristics I just told you. So has already received ESA, has a low erythropoietin production, has no blast, of course, and still a lower risk MDS, and not an incredible amount of transfusion per month. What is the significance for a patient? It means that you can give concrete option of therapy to patients who didn't have anyone. You can't give to a lower risk patient an aggressive treatment, because the advantages are less than the advantages are less than the disadvantages in terms of toxicity. Therefore, this kind of oral drug can really help the patient to improve his or her life.